So, welcome to part 2 for chapter 2. Continuing on, talking about special parent populations, substance abusing pregnant women, right? Specifically fetal alcohol. Fetal alcohol syndrome, which is now fetal alcohol spectrum disorders, includes fetal alcohol effects, which can be a number of birth defects and abnormalities as a result of alcohol use during pregnancy, and fetal alcohol syndrome, which is characteristic of several abnormalities and particular symptoms and identifiable facial features and other characteristics. This is 100% preventable with alcohol abstinence during pregnancy. Pregnant women with eating disorders most commonly found in women of childbearing age, right? So these are particularly predominant between 20 and 35. 5.9% of women in the U.S. experience some type of eating disorder, and there's a lower incidence of eating disorders among pregnant women. So women with eating disorders often will reduce or suspend symptoms while pregnant, and then return to the eating pattern afterward. That's not to say that these don't happen, but oftentimes eating disorders will abate during pregnancy. Eating disorders during pregnancy is concerning because it does affect maternal health, pregnancy outcomes, and proper prenatal care. A hot button issue especially in recent years, has been women with disabilities, the ability to not just become pregnant, but also maintain and manage a pregnancy due to medical advances has become much, much better. Oftentimes, women with disabilities can manage pregnancy and give birth the same way anyone else could. Women with disabilities can give birth to healthy babies, but there's some type of disagreement around reproductive rights with severe inheritable disorders or limited capacity to care for a child. Incarcerated women is another population that is often talked about and is an issue. About 7.5% of women, 7.5% of the population, the total jail population, is women. Prior to entering the criminal justice system, these women are less likely to receive prenatal care, right? Even in the event that they are incarcerated, about 43 states don't require medical exams as a part of prenatal care while incarcerated. 41 do not require prenatal nutrition counseling or provide appropriate or separate nutrition in terms of prenatal care. 34 don't require screening or treatment for those with high-risk pregnancies, and 48 do not require screening for HIV. It's not that these things don't happen necessarily in all institutions, but they're not required by these particular states. Another population is women impacted by HIV, infected with HIV. Due to antiretroviral medications, the risk can be reduced to less than 1% when refraining from breastfeeding and using ARV medications during and post-pregnancy. But the treatment costs are severely high, and there are various barriers and stigmas associated with this particular population. So that's it for the second part. Sorry to have to break that up for such a small portion. If you have any questions, comments, let me know. Thanks.